Hair transplants for hairline lowering. What is better for me, surgery or transplants? Pros and cons of a transplant. I have curly hair. Am I a good candidate? How long before there are bangs fringe length? I'm trying to ask as many questions as I can before making an appointment. Thank you.
Thank you for your question. You're young and you're unfortunately affected by female pattern hair loss, and you're asking about hairline lowering. And you're also asking about the options in terms of transplants and surgery. Well, it just so happens that I am a board-certified facial cosmetic surgeon and a hair restoration specialist, so I think I can give you some perspective on how to take an approach that'll work for you. First of all, let's understand a couple of things. One is there are two types of hair loss that affects 95% of people: male pattern hair loss in men, female pattern hair loss in women. Now, female pattern hair loss tends to be a more diffuse type of hair loss as opposed to male pattern, which is more where the temples go up and they get a receding hairline and the crown gets larger. With women, it's much more diffuse. Interestingly, on women, there is, even in the more progressed female pattern hair loss patients, there is still some preservation of a frontal hairline. Now, you're concerned that your hairline is high, and so how do you approach this in terms of lowering your hairline? Well, I'm going to answer this question a little bit differently than what you are probably used to hearing from other hair restoration specialists in terms of surgery. In my practice, in the past several years, I've developed a way to treat female pattern and male pattern hair loss using regenerative technology. And before we get to that, let's just understand a little bit about what causes hair loss. When we talk about these standard, more common patterns of hair loss, essentially there is some factor that is choking the life out of the follicle. And in men, we know that to be dihydrotestosterone, or DHT. In women, it's an unknown cause, but we believe that there is some inflammation basis for that loss. In addition, based on recent studies that have demonstrated that there are stem cells that are turned on normally with normal hair growth, that in people who are losing hair, stop working. Now, these stem cells are also referred to as progenitor cells, and that's a very important word, progenitor, which means, for our purposes, protect. And basically the progenitor cells protect the hair follicle from the attacks. So what I've been doing in my practice as a normal part of non-surgical treatment of hair loss is an injection combining this material called extracellular matrix with something called platelet-rich plasma. Platelet-rich plasma is drawn from your own blood, and it contains the active growth factors that are also part of the healing process. When we heal, we activate the body's adult stem cells. And so what we believe is the basis of our success is the restoration of progenitor cells which have stopped functioning and protecting the hair follicle from the attack of either DHT, dihydrotestosterone, or from the yet to be determined cause of female pattern hair loss. What we typically see in female pattern hair loss is improvement around 6 to 9 months, closer to 9 months. As a general rule, because women have longer hair, it takes a little bit longer to see the results. A very important factor here is that this injection treatment helps stop not only regrow hair that's thinning, but it stops and prevents the progression of this hair loss process. And it's very important when you consider surgery, think about a simple concept. Think of a treadmill. If you're getting transplants, for example, and then the hair continues to thin, it's like you are taking one step forward and then two steps back. And many female patients who have gotten hair restoration surgery are very dissatisfied because of that. And unfortunately, unlike men who have the option of taking finasteride, an oral drug that blocks dihydrotestosterone, there is no equivalent for women. So if you were to come to my practice, one of the first things I would recommend is the injection, for no better reason than as a kind of vaccination effect to prevent the progression. So now let's talk about the surgical options, because you want to have a lower hairline. This is one of the most common things that people come to us for in terms of hair restoration. They very often say, I want my hairline really much lower. But we have to understand a couple of things. When it comes to hairline lowering, you're looking at a choice between hair transplantation, which is moving hair follicles that are genetically resistant to loss from the back and moving them forward, or doing some kind of incisional surgery which tries to bring the hairline downward. I can tell you I would want to dissuade you from not doing the incisional surgery. Unfortunately, the chance of seeing a visible scar, especially the way you wear your hair, will probably not make it worth it. In addition, the elasticity of the skin and the way the skin heals may be problematic and becomes a greater challenge. And of course, one of the risks of doing incisional surgery, where you're taking out maybe a strip of skin and trying to shorten the length of the forehead to the hairline, is that you can have hair loss as a matter of process and tension. So I almost never really recommend that unless someone has a lot of redundant skin on their forehead, and usually that's women who are much older, and it's part of a brow lifting procedure. So I would recommend considering doing a hair transplantation procedure as part of your goal. Now, the way I approach lowering a hairline is on a more conservative approach. And the reason is this. When you look at your own hair, you'll see how closely the hair follicles are. During transplantation, we can try and pack the hairs as close as possible, 20, 40 hairs per square centimeters. Some hair transplant surgeons make all kinds of claims about 80 to 100 in a square centimeter. But there's a critical factor, and that is blood supply and survivability. So we adjust. So we don't try to do the same procedure on everyone. As a surgeon, I understand the tissue at a different level than a lot of the hair transplant doctors who don't actually perform any other kinds of surgery, but are limited to only working in hair. And so I would say that it is possible to do a good job with hairline lowering, but I would be conservative in terms of the process. And the reason is that if you start your hairline low and you diffusely fill the area that you want to fill, it may look good initially because you see all the hairs looking relatively close together. But as it heals, it may look like there's too much space between the hair follicles. And that's a giveaway that someone has had some kind of procedure or something is wrong. So what I like to do is work from the back, from the hairline forward, and try to place as many hairs as I can in a way so that it feathers in and blends with the hairline, so it looks natural. So even as it's healing, it looks very natural. It is important to be realistic about how low we can make the hairline and how dense we can make the hairline. Invariably, you need more than one session in order to be able to do a reasonable job in getting the density. Regardless of how many grafts we place, we can improve the survivability using the same technology we use in our injection, but we have to be realistic that no matter what, the hairs are going to be further apart than the way they appear naturally in nature. Now we can put single hairs in the front like we typically do and then add 2, 3, 4 hair grafts behind, but still it is my recommendation to all of our patients, men or women, that hairline lowering be done from the back towards the front in a very meticulous way so that a person doesn't look like they have transplants. Unfortunately, hair transplants are very commonly seen as unnatural and, quote, pluggy because too many doctors try to be overambitious and create unnaturally appearing hairlines. So, in summary, I would suggest considering the regenerative technology that we have introduced and has been very successful in our practice, using extracellular matrix and platelet-rich plasma to vaccinate, in quotes if you will, so that it prevents further loss, restore hair that's thinning that will become thicker, and then surgical hair transplantation performed in a realistic way where you don't go too low too early and see gaps as you're healing and then having to be self-conscious about that. So I know I've introduced something different for you. I hope that was helpful, and thank you for your question.